Hi, my name is Kay, and I'm from Unfiltered the podcast. I am the creator and the main host. I am coming to you guys on AIDS Awareness Day with some myths, some facts, and some statistics. We couldn't cover them all in our live, but we're going to cover them now. And to everyone who showed up to the live, I'm very grateful. I'm very thankful. If you guys took something out of it, I'm so thankful as well. Our HIV awareness myths and facts go. You can get HIV from, the myth is you can get HIV from hugging, kissing, or sharing food. Fact is, HIV cannot be spread through casual contact. It's only transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk. Myth number two is only certain people get HIV. The fact is, anyone can get HIV regardless of age, race, gender, or sexual orientation. It's about exposure, not identity. Myth number three is HIV and AIDS are the same thing. Fact is, HIV is a virus, and AIDS is is the late stage of HIV if it's left untreated. With early diagnosis and proper treatment, people with HIV can live long, healthy lives without ever developing AIDS. Myth number four is if both partners have HIV, they don't need protection. That's a lie. Because the fact is, protection is still important. There's different strains of HIV or other infections can be transmitted between partners. Myth number five, HIV positive people can't have kids or can't have children. And the fact is, with proper treatment, positive people can safely have children without passing this virus to their partners or babies. Myth number six, you can tell if someone has HIV by looking at them. Fact, you can't tell who has HIV based on appearance. The only way to know is to get tested. Testing is free. Go get tested every 6 months. Myth number seven is HIV is a death sentence. Not anymore. With antiviral therapy, ARTs, people living with HIV can live long, healthy, fulfilling lives. Myth number eight, HIV can't be prevented. The fact is it can, using protection, getting tested regularly, taking prep if at risk, and avoiding needle sharing all lower the risk of transmission. Myth number nine, HIV test accurate accurate results immediately after exposure. The fact that it can take 2 to 12 weeks after exposure for HIV to show up on the test. That's called the window period. Getting tested too early might give you a false negative, so follow-up testing is important. If you are on treatment, you can still spread HIV easily. The fact is, when a person with HIV takes their meds and maintains an undetectable viral load, they can't transmit the virus sexually. This is known as U equals U. Undetectable equals untransmittable. Fact number 11. Only people who use drugs or are promiscuous get HIV. No, the fact is, HIV doesn't discriminate. It's a medical condition, not a moral judgment. Anyone can contract it if exposed to the virus. Myth 12. Mosquitoes and bugs can spread HIV. HIV can't survive or reproduce inside insects. Bites don't transmit HIV even in areas with high infection rates. Myth 13. HIV treatment is too expensive or inaccessible. Fact is, many clinics, programs, and assistants offer free and affordable treatment and testing. Access has improved worldwide thanks to the community and healthcare support. One of the ones that I want to shout out is the Ryan White Foundation, which is a very good foundation, and they are based off of a 13-year-old boy who needed a blood transfusion, and he got a transfusion um, full of HIV, and he had to live with that, and he ended up passing away at the age of 18, and ended up going his parents ended up making a foundation for HIV patients and their children and think people who couldn't afford the medication or the medical um, like the medication or like medic the medical part of it. Myth 14, HIV always progresses quickly to AIDS. Fact, not true. With early diagnosis to treatment, people with HIV can stay healthy and for decades and never develops to AIDS. Myth 15, if both partners test negative once, they don't need to test again. The fact is, HIV can take weeks to show up in testing, and new exposure can happen later. Regular testing, especially if sexually active, keeps everyone safe. Get tested, no matter what. Myth 16, taking PrEP means you don't need condoms. Fact is, PrEP protects against HIV only, not STIs or pregnancies. Condoms are still key for full protection. Myth number 17, you can't live a normal life if you have HIV. Fact is, people living with HIV can have families, careers, relationships, and lead long, thriving lives just like anyone else. And last but not least, myth 18, if you have HIV, everyone has the right to know. Medical privacy laws protect your status. You have the right to confidentiality. Disclosure is your personal choice, except in some specific legal or health settings. That has been everything for facts and myths and facts. Join me for part two of this for HIV facts and statistics. Okay, this is part two for our AIDS awareness on AIDS World Day. Our facts and statistics. The global impact, approximately 38 million people worldwide are living with HIV. In 2023, around 1.3 million people became newly infected with HIV globally. HIV/AIDS has claimed over 40 million lives since the epidemic began. HIV is transmitted through blood, semen, vaginal fluids, rectal fluids, and breast milk, not casual contact like hugging, kissing, or sharing food. Using condoms consistently and PrEP, pre-exposure prophylaxis, can reduce the risk of HIV transmission over 90%. Treatment and life expectancy with antiviral therapy, ARTs. People living with HIV can live long, healthy lives with life expectancy approaching that of the general population. About 28.7 people worldwide are accessing ARTs as of 2023. People with HIV who maintain an undetectable viral load through treatment cannot sexually transmit HIV to others. This is a game changer for both prevention and reducing stigma. In the US, 1 in 7 people with HIV don't know their status. Early diagnosis is critical. Starting treatment early improves health outcomes and prevents transmission. HIV affects all genders, ages, and races, but certain populations are disproportionately impacted. Sub-Saharan Africa carries the highest burden, accounting for two-thirds of new infections globally. In the US, Black and Hispanic communities are disproportionately affected. With the proper care, the proper treatment during pregnancy, the risk of passing HIV from mother to child drops to less than 1%. Without treatment, the risk can be 15 to 45%. Consistent condom use, PrEP, harm reduction for ID users, which is ID users, I can't really say the word here, and regular texting are highly effective for preventing HIV. Awareness, education, and destigmatization are key public health strategies. Stigma remains one of the biggest barriers to treatment and testing. Fear of discrimination can prevent people from seeking care, yet support, education, and advocacy dramatically improve outcomes. So we are here at Unfiltered the podcast, sharing this awareness so that you guys can know, so that you guys can spread the word and tell everyone they don't have to be scared anymore. They don't have to be ashamed anymore. Spreading the word, ending the silence, breaking the silence, and ending the stigma because so many more people will be less lonely and will feel so much better. That's all I have for today. Happy World AIDS Day and the stigma on so many things, not just AIDS. This has been Kay from Unfiltered. Have a good night.